Hey everyone, Sebaggala Umar is my name on URN podcast. And guess what? Today we're going to be discussing a very important topic. But before I start that topic, I want to share with you a story of a patient that came to my office for consultation today. This was a 36-year-old female who came in with history of long-standing chest pain. She had heartburn, and every time she tries to eat, she feels full. She also had chest pain. Guess what? We examined her and did relevant investigations, and we found out that she had peptic ulcer disease. So today we shall be discussing what peptic ulcer disease is. I know many of you have symptoms similar to her symptoms, and many times people opt to get treated in a traditional way where they take lots of herbal medicines without necessarily getting improvement. So what is peptic ulcer disease? Before we discuss what peptic ulcer disease is, we would like to look at this picture or diagram number 1. Consider your stomach as a masticular bag with lots of acid that helps to digest the food that you take in. But also this acid helps to kill the germs that you ingest along the food in case it is contaminated. So the stomach has an inner lining, which is a mucous membrane that protects itself against the acid which it produces. In that way, the acid that is produced by the stomach never irritates the stomach itself. So what happens or what goes wrong in peptic ulcer disease? In peptic ulcer disease, this barrier of mucous membrane is broken, and once it is broken, then the acid can directly attack the walls of the stomach, and in this way a sore can develop, or what we call an ulcer. So for many decades, spicy foods and stress have been implicated in causing peptic ulcer disease. But today we know that whereas those two things can aggravate or can cause the symptoms of ulcer to worsen and the pain to worsen, they are not the primary cause of peptic ulcer disease. We know that H. pylori, which is a very silica bacteria that has special characteristics that can help it to survive in an acidic environment, is one of the main cause of peptic ulcer disease. This H. pylori bacteria, it destroys or it interferes with this mucous membrane, and in that way the acid that is produced by the stomach is able to irritate the stomach wall, and if this continues over time, we can a patient or someone with H. pylori can get peptic ulcer disease by developing a sore that is as a result of the acid attacking the wall of the stomach directly. Another important cause of peptic ulcer disease are the drugs that are commonly used to treat pain. These are over-the-counter drugs such as diclofenac, such as ibuprofen, such as Indosit, that are used to treat various causes of pain. These drugs are called non-steroidal anti-inflammatory drugs, and by their way of working, they also break this barrier and cause peptic ulcer disease. So, peptic ulcer disease is primarily caused by two factors. One, the H. pylori infection, as we have seen, and non-steroidal anti-inflammatory drugs, as we have explained. So, the two initial factors that were thought to cause peptic ulcer disease, which is the spicy food and stress, do not primarily cause peptic ulcer disease, but they can worsen these symptoms. So in this diagram number 3, we are trying to show you that once the H. pylori has broken the barrier, an ulcer develops. So there are two main types of peptic ulcer disease. One, we call it gastric ulcer, which affects the stomach itself, and another type is the duodenal ulcer that affects the first part of the stomach, the first part of the small intestine. This is the commonest area. So, what are the symptoms? If you have symptoms like chest pain, feeling full after eating just a slight piece of meal, heartburn, or chest pain, pain behind your breastbone, these symptoms could suggest that you have peptic ulcer disease. And how do we fix this problem? If you have those symptoms, we advise you to visit your doctor. Your doctor will be able to carry out some tests, and the two commonly used tests is that the doctor will check your breath to see if this bacteria has produced a breath that will be detected to show its presence in your stomach. Or the doctor will check your poo or the stool to be able to identify this bacteria in your stool. In that way, the doctor will be able to diagnose peptic ulcer disease. Occasionally, the doctor may need to do an upper GI endoscopy, which is a test that is comprised of a thin tube that is flexible with a camera mounted on it. The doctor introduces it through your mouth, through your esophagus or the food pipe, and then into the stomach. With that camera, the doctor is able to see these ulcers reflected onto the system that is attached to the camera. In that way, the doctor can also diagnose peptic ulcer disease. So, what happens after the doctor has diagnosed peptic ulcer disease, or what is the treatment? First of all, it is very important to do life modification. That if you are taking drugs like non-steroidal anti-inflammatory drugs, or if you are fond of prescribing for yourself drugs over the counter, it's very important that if you have symptoms similar to what we have mentioned, that you visit your doctor. Secondly, your doctor, after diagnosing that problem, would be able to give you medicine that is comprised of mainly 2 to 3 drugs. The 2 antibiotics, normally that are prescribed in a short course of around 2 weeks, helps to eliminate this H. pylori infection. In that way, this barrier is restored because the H. pylori has been eliminated. But also your doctor will give you another type of drug that is responsible for reducing the acid in your stomach. and these drugs are classified as PPIs or proton pump inhibitors. These are drugs that are known to majority of our people. They include drugs like omeprazole, drugs like esomeprazole, and drugs like lansoprazole. These drugs will help to reduce on the acid and facilitate the healing of your ulcer. So the good news is that peptic ulcer disease can be cured if one gets the appropriate treatment. So listen to your body and always consult your doctor. If you have symptoms of heartburn, chest pain, abdominal fullness, or feeling full after eating just a small meal, or even sometimes the back pain. So it is very important that you consult your doctor, who will be able to give you appropriate treatment. As we conclude, we would like to give advice to our patient that the most important thing is to seek to consult your doctor in case you have symptoms like the symptoms we have mentioned. Oftentimes, people associate peptic ulcer disease with taking long to eat, with taking drinks that contain a lot of acid. Some others, like we already mentioned, they think that it's because of stress. It is important to note that the above mentioned things do not necessarily cause ulcer, but they can make your symptoms to become more pronounced or even severe. So the most important is to treat the H. pylori infection and to also make sure that you don't take pain-killing drugs when they are not necessary, or to consult the doctor when to take them and when not to take them. As we conclude, I call upon our listeners to subscribe to your RN doctor, share, like, comment, so that we can be able to reach out to many people who would like to get the information that is very key to their health. Thank you for listening to us.